The mission of the MMAC is to unite Canadian Muslim physicians and physicians in training because we see the potential of networking and doing things together rather than as individuals. We advocate for the specific healthcare needs and concerns of Muslim Canadians, provide professional, educational, and social services to our members. Going from a smaller scale endeavor, which was the Welcome Medical Clinic that started 3 years ago, to something that's on a much larger scale, I want to talk to you guys about our Islamic Teaching Hospital initiative. We have an idea and a vision at this point in time, and it's not an original idea. We're not claiming that this was our idea. I know many of you have discussed this over the years with your friends, but as far as we know, this is only being discussed separately and never as a collective, as an Ummah, and that's part of why we call this the Ummah Banquet, because we want to bring all of us together to do better things that we can alone. So the ITHI, for short, is moving forward to discuss and plan this as an Ummah. It's an initiative at this time to create a concrete plan, select appropriate leaders, and act. It's something that will begin now, inshallah, and it's something that may be completed years or even decades from now, but it'll only happen at that time if we begin planning now. We can't keep putting off this kind of thing. What is it? So it's a university-affiliated teaching hospital, planned, built, and operated through the efforts of Muslim professionals and underpinned by Islamic values and teachings. From the medical perspective, I want to tell you why we want to do this. We are all lucky to work in healthcare. We face our mortality every day in our patients. We see them getting sick, and sometimes we even develop the problems that our patients get because we're all human here. None of us are immortal, obviously. None of us know how many heartbeats we have left. I could have 3 left after the next word I speak, for all I know. None of us know that, and we don't know how much time we have left to respond to Allah subhanahu wa ta'ala's call. Our message from our keynote last year, who was Shaykh and Dr. Tawfiq Chaudhry, was to basically think big with our plans to do good deeds. We all do good deeds in this room. Some of us do this on a bigger scale. Some of us do whatever they can. But if we all work together, we can do this on a massive scale. And that's what the ITHI is part of. It's to start a teaching hospital that, inshallah, may branch out to other hospitals in other countries and other provinces in the future. Another reason to do this is the current socio-political climate. I know, not a popular picture, but I thought it was kind of funny. And world events. These days, as we all know, it's quite anti-Islam for the most part. There are many atrocities being committed by the wayward, both in the name of and against Islam. And as we can see, ignorance towards Islam knows no bounds, unfortunately. Now, Shaykh Hamza Yusuf, in a very poignant video lecture that I saw, he said that this world is designed to break your heart, and that's a very profound statement. But when the world breaks your heart, it's very easy to give up and sit back, but that's exactly what we shouldn't do at this time. From a religious perspective, this world is not meant to be, nor will it ever be perfect. That's Jannah. So if the world was perfect, we'd be in Jannah, and obviously that's not the case. This world is meant to push us towards God and away from this world, and towards the next world, to seek the good of the next world through Allah's pleasure and His blessings, inshallah. We know this life is a test, but how do we respond and when? When we accept all of this about this world, patience and an action through adversity becomes much easier. Now is exactly the time to act. It's a time for us to work harder and do amazing things for the community, inshallah. We shouldn't fear the world. We should only fear Allah, subhanahu wa ta'ala. We should move forward with certainty and with confidence that all that is happening is from Allah subhanahu wa ta'ala, and we should continue building goodness into this world to prepare for the next. Shaykh Hamza Yusuf also mentioned recently at Riz that the study of medicine itself with the right intention is a form of religious struggle. The ITHI would help us further this struggle in our struggle to study and practice medicine, to pass on knowledge to trainees, which will help many more patients in turn. Our intentions obviously should be to please Allah subhanahu wa ta'ala. The ITHI would help us improve the image of Islam and Muslims in the public eye. The hope is that this would be pleasing to Allah subhanahu wa ta'ala. We'd obviously be helping patients as well, but in a larger number, on a larger scale, and in more numerous and varied ways than we typically do. Inshallah, we would then attain salvation by pleasing Allah despite all the adversity we face. This is a defense of our religion by doing good deeds that are undeniable, to show everyone that Islam is here to build, not destroy, to heal, not harm, to liberate and accept, and not to oppress or exclude. We will be showing the world, inshallah, that Islam is good, Its followers wish goodness for all living things, and that the outward manifestations of our beautiful religion in our hearts is honorable character, kindness, generosity, acceptance, humility, service to the community, and the easing of the burdens and suffering borne by our fellow human beings of all beliefs. One of the things that Allah subhanahu wa ta'ala likes the most is when we make things easier on a fellow Muslim, a fellow human being, and this is definitely a way that we can do that. Now, the question is how, and I want to start by giving you a quote that I've always loved since childhood. It is to nurture your mind with great thoughts, for you will never go any higher than you think. If you give yourself a ceiling with your thoughts, you will never be able to achieve anything greater than that, and there's no reason why we can't do this, or at least pull together to figure out how to do this with all the amazing talent in this room. This is possible. We just need to adjust to the larger scale of the leadership skills, cooperation, and commitment required. And this is all in this room and in our community. The resources required, and this is all again within our reach, and the time required. And this is something that can be dealt with patience and perseverance that we can achieve through Islam. Our role as an organization will be to be a platform for this project, to coordinate and where necessary, be leaders, to help form an organizational structure. We're going to be applying for charitable status to help this project. We'll recruit volunteers and finally provide resources for planning. All of us here in this room are part of the MMAC. You're all included in this, and together we can do this, inshallah, and we hope that you will join us.
I was very heartened by what I saw here, because I've actually been for a very long time asking Muslim physicians in the United States, why don't we have a teaching hospital? And it's actually really bothered me that we have so many physicians in the United States. In fact, we have the number of physicians in the United States is such that if they all left to join ISIS, we would have a major crisis in our healthcare system in the United States, and that's simply a fact. I'm so happy to see Muslims actually envisioning this, because we know that when we want to accomplish something in the world, the first thing we do is imagine it. One of my favorite hadiths of the Prophet ﷺ is كان رسول الله صلى الله عليه وسلم أحلم الناس. Now that word means that he was the most forbearing of people, but some of our tradition, they take what are called isharat, meanings that aren't really intended by the literal words, but that you can take from the words. And one of the meanings that I get from that is he was the greatest dreamer. That he, ahlam al-nas, can also mean the one who had the most dreams. That our Prophet ﷺ, he looked at the world and he saw something different. First thing is to envision something and then to share that vision, because when we begin to share a dream, it becomes a reality. And the most dangerous of people, if somebody sleeps at night and has dreams, you just call him a sleeper. But when people have dreams when they're wide awake, those are dangerous people, because those are the people that transform this world. And that is what you're envisioning here. You're envisioning a dream of something that should not be 1 or 2 or 3. There should be a Muslim teaching hospital in every city in Canada, every major city. We should have a Muslim teaching hospital in every major city in the United States. And we should treat the poor, and we should treat the needy. One of the most important institutions in the United States is the Mayo Clinic. And Bill and Charlie, who were the founders of this clinic, 30% of all their patients were given their bill with paid in full, because they actually donated. 30% of all of their medical practice was volunteer, because they believed that a physician was first and foremost a servant of the people, and not somebody who gets rich off the calamities and trials and tribulations of people. Everybody needs to make a living, and there's no reason why you shouldn't make good livings as physicians, but medicine is a vocation, from the Latin vocare, a calling. And if it's not something deep in your heart, you really shouldn't be a physician, because physicians are meant to be healers. Our Prophet ﷺ once fell off a horse and he hurt his back. And a man came to see him and he said, "Who are you?" He said, "Ana tabib, I'm a physician." He said, "Bal anta shafiq." You're not a physician, you're a compassionate person. God is the physician. It's such a beautiful statement of how he looked at the world. There are a lot of things that you can do, and we should be contributing. This is what the Muslims are. We're contributors to civilization. We took civilization for a long time. We were the heads of the caravan. Now others have taken it, and unfortunately they're driven largely by profit. We were driven largely by profits as well, but we spelled it P-R-O-P-H-E-T-S. They spell it P-R-O-F-I-T-S. So you're either driven by profits or you're driven by profits. And you have to choose what's driving you. And so it's really important for us as a community. So I really hope that you take this seriously. I would love to see the Canadian physicians do this. Our religion's a religion of hope. We should always look at hope. So I'm really hoping, my hope is a thing with feathers that perches in the soul. It's something that really keeps us going. And this is a very hopeful project. And my hope is that you grow. I'll put you on my Facebook, hopefully get some more, drive some more traffic to you. I would love to see your organization grow and become really strong. I'm really happy to see so many young physicians in here. And no offense to the older physicians, but we're transitioning out, our replacements are here. And so it's good to see that. So this is a young organization, and I really hope that you grow. And I would love to be a consultant on your project and to see it come to fruition. And one day maybe you'll invite me for the opening. I would love to see it realized soon, inshallah. Jazakumullah khair.